Well, joining us now to shed more light on what happened and what it means for young athletes and their families is Dr. Antonio Fernandez of Hartford Hospital. And Doctor, we certainly appreciate you joining us here. This is not as rare as we would like it to be, and from time to time young athletes collapse. The question is always the same: how can something like this happen to a young athlete in prime condition?
Yeah, absolutely. So this brings back memories of other athletes, very prominent athletes who died in their prime, like Pete Maravich, who had a coronary anomaly, you know, Reggie Lewis. So it's not an unheard event, but it is definitely not a frequent one either. Obviously, when this happens in the field and in somebody who is young in the prime of health, that attracts a lot more attention. Tragic, but certainly attracts more attention.
It almost has to mean that there was some hidden defect in the heart somewhere that they were not aware of. Would that be the case?
Yeah, so it could be. I think we don't know enough about this particular case, but we know that sudden cardiac death and sudden cardiac arrest in young athletes in the United States could be due to certain numbers of cardiac pathologies, and we have some data from the United States, and there's also data from Europe that helps us kind of understand a little bit the most common causes of cardiac arrest.
How rare is it? Is the way to quantify that?
Yeah, so that's a very controversial issue as well. Okay. So the data from the United States estimates close to 1 in 100,000. Data from Italy, which most of the European data comes from, it's a lot more frequent. Also, you know, the NCAA some authors have done research on NCAA athletes, and that seems to be more frequent, like 1 in 53,000. So it really depends on what we're using for the denominator, and the data is not perfect, and therefore there is variance and controversy.
Yeah, we don't really know at this point exactly what has happened with Bronny James himself. This is the latest case that has brought up the issue. We were just talking before the interview that young athletes are required to have a physical each year. And I don't want to suggest that it's not as thorough as it should be, but these kinds of things won't necessarily show up in a typical yearly physical for an athlete, would they?
Yeah, it would depend on what the diagnosis is. Right. So here we don't really know, but for certain things we can certainly pick it up on history and physical, which the American Heart Rate Association is what recommends for organized sports. But different leagues have different screening strategies for screening their athletes.
No. Last question then. I want to give parents something to go on here, because a typical parent out there who has a junior high school kid, even college kid who's playing some sport, and millions do, they hear a story like that and they're horrified by it and scared to pieces by it. What do parents need to know? Is there anything they can do or that coaches can do to just keep an eye out for any kind of signs and just keep their athletes safe?
Yeah, absolutely. So I think that events like this highlight the impetus from some professional organizations like the American Heart Association to impart CPR training to lay people. So having more awareness about how to use an external automated external defibrillator, because the best chance of somebody who's suffering a cardiac arrest of survival really depends on high quality CPR and the ability to defibrillate really within 3 to 5 minutes after the collapse.
And that's not a tremendously expensive piece of technology. It'd be a good idea for all schools to have one nearby, correct?
Yeah, absolutely.
Yeah. All right. Dr. Antonio Fernandez of Hartford Hospital, we appreciate your time today. Thanks for joining us. All right.